Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, alleged irregularity in a multi-billion health project.
I really think it just points out to one thing. It's poor planning right from the very start.
But former Health Secretary Janette Garin sees nothing wrong in the Barangay Health Stations constructed during her term.
Alam nga namang pumirma ka ng MOA kung walang pondo.
Also, the rising number of leptospirosis cases in the country.
Ang sakit na ito ay pwedeng madali pong maiwasan at madali po ang gamutan. Pero kailangan din po natin ng mga pasyente alerto.
And an update on the controversial Dengvaxia program. Health Secretary Francisco Duque III joins us live. And later, death-defying stunts by robots. That's for today's In Focus. Thank you for joining us. Sitting in for Pinky Webb, I'm Cherry Mercado. Lawmakers probe the alleged irregularity in the Health Department's multi-billion peso Barangay Health Stations project. This was implemented during the term of former Health Secretary Janette Garin. Senators also questioned the timing of the project, but the former Health Secretary insists that there's nothing anomalous. Also, what triggers the recent spike of leptospirosis cases in the country, and how is the Health Department handling the Dengvaxia controversy? Let's go straight to the source of the story. Health Secretary Francisco Duque III is here to join us this morning. Hi, sir.
Hi, Cherry.
And thank you for joining us.
Glad to see you.
Oo. Before, I just have a quick message to our viewers before I start with the first question. If they might think na sawa na sila sa Dengvaxia o usapan ng, kasi maraming nahabaan kahapon sa Senate hearing, no? This involves public funds in billions of pesos and could have possibly compromised thousands of barangay health centers na dapat meron tayo. No? So yung pinag-uusapan po ngayon, yung bagong pinag-usapan kahapon sa Senado, is the Barangay Health Service Units. Let's first see the statistics. Ilan ba dapat yung Barangay Health Service Units na kini-question nyo na dapat ay nangyari o binigyan ng pondo, no, noong panahon ni Health Secretary Janette Garin. So ang target, 5,700 Barangay Health Service Units. Ang nakumpleto is 270. Ito, controversial tong numero na to kasi ang sinasabi ng mga nagpatayo, 426, no, na sinisingil ang DOH for 426. Ang may dokumento lang, that's not 218, that's 8.
It was 270 and then 8 about a week or two ago. Ang nakumpletong dokumento, 8 nung task force. Because there are 10 documents that you need to submit. And
okay.
Before you say this has been completed, that's one of the parameters to determine completion.
And kaya importante yung completion kasi hindi babayaran kung hindi kumpleto
Yes.
yung mga dokumento.
Well, that's the controversy here because the contractor is saying it's the accomplished works and not completed units. Ang intindi ko, kahit na walang tapos, basta 20% noon. So pwedeng pads lang, o pwedeng poste lang, or pwedeng wall lang, eh dapat bayaran na. Eh tingin ko, mahirap naman yun. Makukuha naman kami. Kasi,
okay, let's hold it right there, Secretary Duque. We're showing now some of the structures, no? Klaruhin lang natin for our viewers, no? Anong ibig sabihin ng Barangay Health Station? Is it the same as a health center? Ano ba ang meron sa isang Barangay Health Station na gustong ipagawa?
batay sa datos ng DOH, mga 42% lang ang mga barangay na meron na health stations. Health stations ang tawag.
Ay, anong kaibahan ng health station
Meron,
sa
malaki.
health center?
Sa barangay health station kasi, this is the basic delivery unit. Okay, that's closest to the people in the barangay. The next would be a health center. It could be a rural health center.
It's a higher level,
It's a higher level delivery unit.
Para mahati sana, may health stations in
Satellites
satellite.
mo. Oo,
sa
ganon.
maliliit.
Kasi mauna yan, Cherry, no? Barangay health station, tapos rural health units or rural health centers, city health centers, tapos meron ka ng mga district hospitals, tapos meron ka ng provincial hospital, tapos meron ka ng DOH, level 1, 2, 3 hospitals, and specialty medical centers, heart, lung, kidney, children.
Yon. So magandang proyekto. Na maglagay tayo. Dapat nga meron na tayo nito by now.
Well, we have about 42%, but we lack about 21,000 pa.
So, dun sa target, nung panahon ni Secretary Garin, 5,700 dapat. No? So, ang napagawa lang, at ito yung kontrobersyal, ang napagawa lang ay, ayon sa task force ninyo, 270 ang kumpleto.
Kompleto, pero 218 ang naitayo na yung 270, 218 so far as of yesterday ang nakumpleto ang dokumento.
Ilang taon yun, sir? Ba't ang konti?
2 taon, dahil nga nagkaroon ng problema, yung sabi nga ng kontraktor, hindi naman nakumpleto ng DOH yung pagbibigay ng listahan ng 3,200 sites. Tandaan mo, this is supposed to be a project entered into via a tripartite MOA between the DOH, the DepEd, and the DILG. DepEd was to commit the lot or the location. DOH was to have the BHS constructed, and then the DILG would seek commitment of the local government units to ensure there's water and electrical supply.
So, yun ngayon ang naging problema. Yung pondo nun, dapat, for the whole 5,700 units,
It's about
is
8.1 billion.
8.1 billion.
Pero
Okay.
ang naibayad na 1.2 billion.
Naibayad na ito.
Oo, yung
no?
6.9 billion still with
Hindi
that
pa
bank.
lumalabas.
Hindi pa lumalabas
Oo.
yan.
And
Oo.
ito yung hindi mo ni-release, hindi ba? Meron silang mga pinadalang collectibles, no?
Yes, a
Naniningil
bill.
sila.
They were
bill.
sending the bills. Oo. Pero nung nakita ko nga na pabago-bago yung numero, nagsuspecha na ako.
Saan ba galing, sir, yung pondo dapat for the 8.1 billion? Kasi kini-question din natin yung pondo. Hindi ba? Did this come from the Senior Citizens PhilHealth Fund? Or galing ba ito dun sa DOH Fund pero sa ilalim dapat ng mga ibabayad sa empleyado?
Alam mo, noong una, ganun din ang mga katanungan sa isip ko. Kaya nga, minabuti ko, pumunta ako kay Secretary Ben Jokno kasi DBM will be able to more or less clarify that issue. Ang sabi naman sa akin, at nag-certify naman sila, na yung pondong ginamit doon sa SARO, covering the Barangay Health Station, the dental vans, and then the medical checkup equipment and materials, no? Galing ito sa Miscellaneous Personal Benefit Fund Savings. Yun ngayon ang ginamit. At lumabas yung SARO December 29, 2015.
Magkano yung
Ang
naibigay
SARO
doon
was,
galing
I think, kung di ako nagkakamali, mga 9.6 billion, more or less. Tapos, 4.6 billion was for Barangay Health Station, 630 million for the dental vans, and then the remaining for the BHS checkup, medical equipment, and other items.
So, hindi galing dun sa PhilHealth Senior Citizens
Based on the
Fund.
certification ng DBM, hindi.
Pero ito
Very
pong
safe.
9.6 billion na galing sa Miscellaneous Personal Benefits Fund, yung pondo ng gobyerno para sa mga pasweldo, no, sa mga plantilla positions na hindi naman, wala namang tao dun sa mga posisyon na yon. Ito po na ilabas to, may SARO to, 9.6 billion.
Oo.
Saan po napunta kaya ito?
Ito na nga, yung para sa Barangay Health Station, 4.6
Pero
billion.
1.2 pa lang ang
1.2 pa lang na
So
ilalabas.
intact po yung the rest.
Well, kasi yung SARO na binanggit natin, yan ang nagponto dun sa Phase 1. Yan yung pondo ginamit, mga 4.6 billion. Tapos, another mga 4.5 yung sa Phase 2. Yun naman galing sa General Appropriations Act yun. Hindi yan galing dito. Yun talagang nakalagay yun doon sa plano.
Pero may na-discover po na merong inilabas, no, na SARO on the same day, parehong para sa Dengvaxia, which is 3.5 billion, please correct me if I'm
Yes,
wrong.
tama po kayo.
And another, how much billions for the BHS on the same day of the last day of
Yun na,
December
mga 9.6 billion yan.
So 9.6 plus 3.5, naglabas
12
ng
something yan.
12 something. A lot of the senators were finding this as a red flag. Ano bang ibig sabihin nito? Sa tingin niyo ba minadali yung pondo, minadali yung proyekto?
Mukhang gano'n na lumalabas, pero ang sabi naman doon sa mga nagdaan hearings, alam mo kasi ito ay naging subject matter ito ng maraming Senate, Blue Ribbon committee hearings, and even in the House of Representatives. No? Ang sinasabi ng DBM ay legal naman daw yan at pinahintulutan naman daw ng Korte Suprema itong paggamit ng mga savings. Pero of course, may mga sinasabi din ng mga senador, hindi, dapat yan pinadaan ninyo sa Kongreso. Kongreso dapat ang nag-appropriate niyan, siya dapat ang nag-approve. So may ganun, hindi tapos na usapin.
Okay, so we'll continue this. Secretary Duque, I'll ask him when we go back kung sa tingin ba niya, kasi there was a congressman who floated also, is this a triple scam? Dengvaxia, PhilHealth funds, and the funds for the Barangay Health Stations. Ito bang tatlong ito, yung mga pondo bang ito, ginamit para madaliin para sa eleksyon sa May 2016? There's that question hanging, and we'll try to get the answer when we come back. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque III. We're still talking about some of the controversies in the health department, some of which you're questioning. And there are some questions now. No? You formed a task force. You gave information to the Ombudsman, to the Senate, and to the
COA.
House of Representatives and to COA to investigate these funds that you are questioning and the projects that you're questioning. Pero may mga nagtatanong din, sir, what do you want out of this? Because some people are asking, is it politically motivated? Is the government now trying to get back to the past administration? Sinabi na rin ni Health Secretary Garin na sana daw wag magpagamit si Secretary Duque, not to be a pawn, to get back to the past administration. Your reaction, sir?
No, walang ganun. Kasi trabaho tungkulin ko bilang Secretary of Health na siguraduhin na kung ang mga proyekto ay maayos, ay pagpatuloy natin, pero kung ang mga proyekto na nababalutan ng kontrobersiya at maraming mga tanong, lalo na pondo ito ng ating mga taxpayers, nagbabayad ng buwis sa gobyerno para tumakbo ang mga ahensya ng pamahalaan, ay dapat tingnan natin. At lumabas naman to, hindi ko naman to inimbento. Itong mga dokumentong ito, lumabas ito. In fact, 6-7 months into the office. Noong April, nagpagawa nga ako ng task force. Kasi nga, hindi ako makakuha ng malinaw na kasagutan sa mga simpleng mga tanong. Ilan ba talaga ang natapos?
Are you going to continue the Barangay Health Stations program? Are
Well,
you going
depends.
to ask for it to be suspended?
But depends. Some senators are advocating for the continuation of the Barangay Health Station construction because we still lack about
Kailangan pa rin.
19,000 BHS. And this is a major building block of our universal healthcare aspiration. And I don't mind if we have to restart this project, but for as long as we need to do it in such a way that the planning has to be thoroughly made and all the components, really himayin mo yan sa planning stage. Kasi paano execution? Bad planning, bad execution.
So mukhang i-execute ninyo pero in a better way.
Yes, at
Mukhang yan
hindi natin pwedeng madaliin ito kasi you're talking about 5,700 units. And you cannot do that in just 6 months or 1 year.
Sir, let's move on to PhilHealth.
Yes.
You're also a doctor. What's the prognosis on PhilHealth? Kamusta ba ang health ng PhilHealth? Is it naghihingalo? How are the funds? And how do we plan to make it a better performing agency?
Well, you see, the April financial report, FS, statement of PhilHealth, April, they were very much ahead of their target. So, in other words, mas malaki yung pumasok na pondo kesa doon sa lumabas. So, positive. They're positive right now. And I hope that is going to be consistent until the end of the year and the following years.
So, hindi totoong kasi si Senator J.V. Ejercito is also worried about the funds, the financial health of PhilHealth.
Well, the reserve funds of PhilHealth is now, I think, at 10-11 months. It's down from 24 months.
Ano dapat?
Well,
Dapat
24 months is what the law says, but you cannot go beyond 24 months because if the reserve funds go beyond 24 months, you have to do one of two things. You bring down the premium contribution rate or you increase benefits. But in this case, the law kasi, where we need to amend the law because it only sets the ceiling, it does not set the floor. In other words, you can have a reserve fund of, say, 1 month, 2 months, and you're still
lang.
okay. That's still
Pero ngayon,
legal.
10 months ang reserve.
10 to 11 months ang reserve
in your
funds.
reading, is that okay?
Yeah,
Is that okay?
well, no. During my time kasi, I made it sure
24 months.
24 months yan.
Your diagnosis on PhilHealth, it's okay? It's in
I think based on, I mean, if I were to use as a metric its capacity to pay, it's okay naman. In the benefit, the bills that
hanggang kailan? Hanggang kailan siya okay?
well, the actuarial life of PhilHealth, I think, is going to be about 10 years.
Secretary Duque, update on lepto.
Well, lepto in NCR in particular, we have an increase in the number of cases from 148 to 299, representing a 102% increase. And this is alarming, and that is why it is very important that our people are aware of this, and that the measures to prevent spread have to be in place.
May
And-
outbreak na ba, sir?
Yeah, may outbreaks na tayo ngayon. Towards the end of week 26, beginning week 27, we have outbreaks in the following cities: Mandaluyong City, Pasig City, Quezon City, and Taguig City.
So these areas that you mentioned already have outbreaks?
Yes, this is already considered outbreaks because they've already breached the epidemic threshold, which means that the cases reported now in these cities or in the barangays, as I have stated them one by one, they have already gone past the number or the average number for the last 5 years.
In that same area?
Yes, that's right, exactly.
And you explained later kanina, sir, it could be misleading din, ano? Now, with the areas with the outbreak are not necessarily where the bacteria thrives most.
Yes, that's right. Where the flooding might have been in a faraway city or barangay, and that happens, no? So it's a bit tricky because it doesn't necessarily mean nakuha talaga dun sa, say, Addition Hills, no? Or sa Pinagbuhatan. Pwedeng nakuha sa ibang lugar eh. Because, you know, so you're talking about wide areas of flooding.
Ngayon, kung may outbreak na, what's going to happen? What does it mean that there's an outbreak? Does it mean more funds for this area? What are the changes in the operations of DOH?
Well, you just have to level up at the different levels. At the hospital levels, they have to make sure that they're capacitated to do evidence-based best practice management of clinical management of leptospirosis. Of course, the disinfection of soiled materials or articles, and then reporting to the next higher level. And then, of course, at the level of the local government units, this is very, very important. They've got to do 4 things. Number 1, rodent control. Okay. Number 2 is the improved flood control programs in their respective localities. And then the next is draining of potentially contaminated waters. And then lastly would be enforcement of garbage collection. That's very important because the rats from the sewer, yung mga galing sa imburnal, pupunta yan doon sa mga basurahan. So pagka hindi mo kinukolekta ang basurahan, marami, magta-thrive ang mga daga at yan ang iihi, yan ang hahawa sa mga tubig at yung mga naman lumulusong sa baha ay magkakaroon ng leptospirosis. Whether may sugat o wala, ay posibleng tamaan ng leptospirosis. Kaya kinakailangan alerto ang mga tao, ang mga bata, na kung may lagnat, kahit na parang trangka-trangkaso lang, at nagkaroon ng patunay na nabaha sila, lumusong sa baha, magpatingin na sa pinakamalapit na paggamutan.
Sir, update on Dengvaxia.
Okay.
Ano ngayon ang bago sa
May mga
Dengvaxia?
kaso.
What are you?
There are cases have been filed before the Department of Justice, and some in COMELEC, and I think, I don't know if there are in regional trial courts, no? But the status there is the DOJ is still evaluating the complaint and the counter affidavits. So we have sent, the respondents have been ordered to submit their sworn counter affidavits.
How do you see this ending? Ano ang gusto niyong maging ending sa Dengvaxia story?
Well, to me, one is for Sanofi to return the equivalent of even the used stocks of Dengvaxia, which is about 1.8 billion. Remember, we were able to successfully get them to refund 1.161 billion from the unused portion of the vaccines. No, so we will be soon filing this with Office of the Solgen. They're helping us do a case build up, and hopefully we'll have a strong case, but that really depends on the pieces of evidence that we will be able to put together.
This is a case versus Sanofi.
Yeah, there's a case against Sanofi, and then there are cases filed against the DOH, current and previous officials. And so the President Rodrigo Duterte has given a directive for them to put together, the concerned agencies to put together a panel of experts from the Southeast Asian, ASEAN member countries where the Dengvaxia was implemented, was utilized. But although there's none among the Southeast Asian nations that did this on a subnational scale, on a subnational level, they did it private. Malaysia, Singapore, Thailand.
Na sinasabi nga, overpriced yung pagkakuha natin.
Well, maraming mga ganun na mga haka-haka.
Mahaba pa itong Dengvaxia, sir. Ito, isa pa sa mga aabangan natin. Ano?
Yeah, pero thankfully, yung naman mga bata na nagkakasakit based on our adverse events following immunization with Dengvaxia, to date, we have about mga 5,900 who had manifested different forms of illnesses, and 98% of those recovered. Unfortunately, about 2% of them died for several reasons. No? Could
Secretary
be dengue
Duque.
and other fatal illnesses.
Thank you so much for joining us, and it's
Thank you
always a
very
pleasure
much.
to have
It's a pleasure
you.
too. In behalf of the DOH, thank you very much.
This is The Source on CNN Philippines. Coming up, have you ever heard of Stuntronics? Well, these stunt robots will show you how on today's In Focus. Time now for today's In Focus here on The Source. Disney's research and development company has just released the video of Stuntronics. These are robots capable of performing death-defying stunts at Disney's theme park attractions. Let's take a look.
We created a new type of animation. So new that we had to invent a new name for it.
Audio animatronics?
Right, audio animatronics.
Thank you for joining us here in The Source. I'm Cherry Mercado. You're watching CNN Philippines.